to $500–600. So you might have to pay a little bit more up front the first month or so that you're getting your prescriptions filled. But maybe at the end of the year, you've got extra money in your pocket. So we can help you with that. That's what keeps us very busy this time of the year. Because again, it's open enrollment, October 15th to December 7th. It's earlier this year. It used to start in mid-November and go to the end of the calendar year. So my fear is that, and you're seeing the ads on TV, I'm sure. I know everybody knows about the mid-October date, but I'm afraid they're going to think it's extending until the end of December, and it's not. So Pearl Harbor Day is December 7th. That's the best way I can remember the end of open enrollment. But definitely, that's the end of open enrollment. That is when you sign up for your drug plan. No matter which way you take your drug plan, you choose it. October 15th to December 7th is when you will do that. There is a couple of ways to take your drug plan. You can take the standalone drug plan with a supplement plan to cover your health insurance, or we'll talk about in a few seconds the Medicare Advantage plans, which are the HMO plans. And that drug plan will be bundled into all of it, just like the HMOs have always been if you've ever been on an HMO before. They're just now associated with Medicare. Is anybody familiar with the donut hole? Yeah. The donut hole, that's how I always say, oh yeah. The donut hole was designed into the plan back in 2006. And what it does is, after a certain amount of money has been spent on prescription drugs, between what you have paid at the pharmacy for co-pays and what the insurance company has paid, when that magic number of, for this year, $2,840 has been met. For next year, it's $2,930, okay? Then you start paying a lot more for your drugs. So if you're suddenly paying a lot more for your drugs, and you say, what happened? You probably went into the donut hole. Not everybody falls into the donut hole. Some people have such expensive drugs that they fall into the donut hole in February. Usually it's around August, September, we start getting those phone calls. Oh, I'm paying too much for my drugs. You're in the donut hole. There's good news about the donut hole. It's not as good as we'd like it to be, but it's going in the right direction. Starting with this year, if you go into the donut hole, you'll get a 50% discount on brand name drugs and a 14% discount on generic drugs. The donut hole is shrinking. It won't be completely gone until the year 2020, but it will be gone. I know, I've had people say, but I won't be here either. I say, well, you won't have to worry about the donut hole, but at least it's going in the right direction. So that's one way, and the discounts are in there. But another way that you can get some assistance in the donut hole is to sign up for Prescription Advantage. There are some forms over there, and Jeff has some of these as well. Prescription Advantage is not an insurance plan. It's been around for quite a few years in Massachusetts. For a lot of people, prior to 2006, it was their prescription coverage. But what Prescription Advantage does for you, actually, it does a few things that are very beneficial. It does help you when you're in the donut hole. So if you go into the donut hole, and as long as your drug is covered by the plan that you chose, which is why it's important to make sure all your drugs are included in the plan that you choose, it will give you a bigger discount while you're in the donut hole. It's income eligible, but it doesn't count assets. So some people can get into this program. It doesn't cost you anything as long as your income for an individual is under $33,000 and change. And we'll see this somewhere here, at $44,000 for a married couple. It doesn't cost you anything to join it. So this is something worth applying for. It also gives you an exception to the rule, a special enrollment period, if you want to sign up for a drug program outside of open enrollment. So let's say you sign up for a plan today to be effective in January. In February you say, oh God, I don't know why I picked this plan. You kind of just went down the list and went in alphabetical order. It doesn't cover any of your drugs. If you belong to Prescription Advantage, you can change your plan, okay? Or if you never took a drug plan, and now, outside of open enrollment, May or April, you say, yep, time for me to sign up for a drug plan. My doctor just wrote 3 prescriptions for me and I don't have a drug plan. And it's not open enrollment. You could then sign up for Prescription Advantage, and once you've been accepted into Prescription Advantage, you can then sign up for a drug plan. It also covers some categories of drugs that the drug plan, that Part D doesn't cover. there's a number of drugs that they don't cover, and that will be changing over the next couple of years. But for example, benzodiazepines, so lorazepam and Valium are not covered under the Part D plans, but Prescription Advantage will give you coverage for those drugs. So there's a lot of good reasons to sign up for it. Again, it's a Massachusetts state plan that you can help with that, and Shine Council can help you with that. Another way to get some assistance with your drug coverage is through a federal program. You would apply through Social Security for it. We can do that for you as well. You can go to the Medicare website and it'll get you to the Social Security website for it. It's called Extra Help. It's for people who have low or moderate income, and you could get full or partial extra help. And if you qualify for that, it's income and asset eligibility. But if you do qualify for it, you won't have to pay a premium for your drug plan. If you have a penalty, it will be forgiven. If you get partial extra help, you'll only have an annual deductible of $62 or $63 a year, and then you'll be paying a very small amount for your drugs along the way. And you can change your drug plan every single month if you're so inclined. Okay? But that's, again, something worth talking to a Shine counselor about. With the extra help plan I just described, you can do that any time of the year. You don't have to do it during open enrollment. You don't have to do Prescription Advantage during open enrollment. You can do it any time during the year. So it might be something you want to take a look at, sometime during the winter. Okay. So we talked about Prescription Advantage. Any questions on either of those two programs?
Does all this go with you if you're not in Mass? I mean, if you're traveling, or if you're
in
Florida
plans,
or something like
no,
that?
you need to be careful about that, and we're going to talk about that right now. With the drug plans, there are quite a few of the drug plans that are national drug plans, and they'll cover you anywhere. So if that's the case, if you travel a lot, you go to Florida for the winter, you want to make sure you have a plan that's a national plan, so that you'll have coverage. So look, I will get to that in a minute when we talk about the Medicare Advantage plans, because that's a very, very good question. So the other way to take your Medicare, so we just kind of wrapped up the traditional way to take Medicare. Another way is to do the one-stop shopping of Medicare, which is Medicare Part C. That's what it's officially called. It's also called the Medicare Advantage Plan. The Medicare Advantage plans, the one-stop shopping of Medicare. They're HMOs, and a couple of them are PPOs. If it's an HMO, as all HMOs have always worked, you have to stay within the network. So your doctor has to be in the network, or the plan is useless to you. And there are restrictions with those plans. The premiums might be, a little less expensive than the supplement plans on this list. But you'll have a copay every time you go to the doctor's office. You'll have a copay when you go for physical therapy. There'll be some copays if you go to the hospital. And we have a chart over there with all the Medicare Advantage plans. It's only 3 companies. It's Tufts, AARP, and Blue Cross are the only 3 companies that have Medicare Advantage plans. They're very good plans. It just depends on what makes sense for you. If you choose to go the Medicare Advantage route and you want to have a drug plan, you have to take your drug plan with the Medicare Advantage plan. You can buy Medicare Advantage plans without drug coverage and with drug coverage. But that, if you want drug coverage and a Medicare Advantage plan, you have to take it all from that plan. You can't split up apples and oranges, okay?
Can you name the 3 again? I don't
Blue
want
Cross Blue Shield,
Okay.
and I do have charts over there. Blue Cross Blue Shield, Tufts, and AARP, which is also United Healthcare. They're one and the same. The trick is, there's a couple of things. Again, you have to be in that network. Mass General doesn't take the Tufts Medicare Advantage plans, okay? So a lot of people dropped out of those the past couple of years. Cambridge Health Alliance just announced it's not taking the Tufts Medicare Advantage plans. They may take the regular Tufts HMO, the non-Medicare ones. So somebody's working and they have a Tufts HMO through work. Mass General probably takes that, but they're not taking the Medicare version of it. So if you have it, before you go on Medicare, you should specifically ask your doctor, and we tell everybody this, before you sign up for a Medicare Advantage plan, call your doctor's office, your primary care physicians, any specialist you go to, and ask them, what Medicare Advantage plans do you take? Because why take something that you can't use? Again, open enrollment time, October 15th to December 7th, is when you sign up for that plan. And it's not easy to move out of it. We'll talk about that a little bit down the line. You still have to pay your Part B premiums, because you're still under the auspices and the coverage of Medicare Part A and B. It's just billed differently in the background. It's invisible to you. You'll pay co-pays when you go to doctor's offices or for any outpatient therapy. And I caution people with this. If you go, we had 2 clients this year, both of whom had knee surgery. One had a supplement plan and one had a Medicare Advantage plan. They had their surgery, everything, was okay with the billing, everybody's fine. They each went to a rehab for about a week, and however things worked for that for the billing. But then it was time to do some outpatient physical therapy. And if anybody's had knee replacement, I think you know the drill. It's, for 2 or 3 times a week for, 8 or 9 weeks, whatever it is, you go for outpatient physical therapy. If you have a supplement plan, you don't pay a copay every time you go for the physical therapy. If you have a Medicare Advantage plan, you may be paying $15, $20, $25 every time you go for a therapy session. So times 3, times 8 or 9. So my advice is, it's always your choice to take whatever you want. And you know what makes sense for you and what works for you. If you're going to have knee replacement surgery, you might want to look at this list, because if you're not making a lifetime commitment with any of these plans, you can change them the next year under certain circumstances. But when you know it's a planned event, and you know that you're going to be racking up those co-pays, the supplement plan may end up being less expensive for you than the Medicare Advantage plan under those kinds of circumstances. If you only go to the doctor once or twice a year, you're fine with the Medicare Advantage plan. Another thing is, this gentleman brought up, if you have a supplement plan and you're fortunate enough to get out of Dodge, January and February, you go someplace warm, you'll have coverage if you're in Fort Lauderdale for a couple of months of the year with your supplement plan. You'll have Medicare A and B, and you'll have coverage with your supplement plan. If you have a Medicare Advantage plan, you're out of network. You will not have coverage. You'll have emergency coverage. So you sprain your ankle, you go to the emergency room, you'll be treated, and your coverage will take care of that event. Then the doctor says you need to go for some physical therapy for a couple of weeks until that ankle gets stronger. You will be out of network, you will be paying out of pocket. So if your lifestyle is such that I would not make my decision based on a 1 or 2 week vacation by any means. But certainly if you go away for a significant period of time during the year, you would want to consider a supplement plan in order to have that coverage with you. So that's very, very important, yes.
You were saying the Tufts Advantage plan, like MassGen, what about the Tufts supplemental? Is that
They
different?
take the supplement. Anybody who takes Medicare will take the supplement plans, whether it's Tufts or
Doesn't
Blue
matter
Cross.
which one it
They
is?
take the supplement. It's the Medicare Advantage plans that they don't take. What happened to Tufts a couple of years ago, and that's a good plan, they just redesigned their plan to make it even more restrictive, and I think this is why some places are backing out of it. They have what's called a circle. So you have the network, and then within the network is the circle. So your primary care is in the circle, and he or she can only refer you to specialists within that circle, even if there's a cardiologist that's in the network. But if that cardiologist isn't in your doctor's circle, it's like the circle of friends with the phone, with the cell phone. So that, a lot of people don't like that because they feel that they're really too restrictive. I mean, HMOs, I have an HMO at work, I live within the network. But boy, if I had to live within the circle within the network, I'm not so sure how happy I would be with that. So you want to check that out.
I've been in an Advantage plan, and I had to have physical therapy, $40 and a visit.
A visit, right?
Wow.
Okay, so, but you don't realize, I mean, you can't predict what's going to
No,
happen.
you can't, no.
But I mean,
$40
obviously,
a
if it's
visit.
something that you know, if you know, this is the year I'm going to have the hip replacement or the knee replacement,
But that's something,
That's- who would think about it?
Yeah, it wasn't a replacement, but it was just something that happened and I had to have therapy.
Right,
and
and
it's like,
that's
whoa,
it. No,
that was
I
an
know.
expensive therapy session.
So I mean, this year, those 2 clients, and they happen to come into our office within the same week. So it really hit home, because one was still walking with a cane, and guess which one was still walking with a cane? And I'm thinking it would be nice if the doctor's office had said, this is what we're going to be doing, what is your kind of insurance do you have? And you can think about it, you can at least plan for it. Maybe she could have waited till open enrollment switched, because you can do that,
Yeah.
Anyway, it's just another little thing to think about.
You just didn't
Little
know.
surprises. Oh,
Isn't it
these
wonderful?
little
When you
surprises.
work, your employer just hands you an insurance plan, and you say thank you.
When you work.
You pay your premium, it comes out of your paycheck, you don't know it. You get on Medicaid,